Doing really well here, Neil. And you?
Fantastic. And today's topic is Hantavirus. And people are talking about the death of Gene Hackman and Betsy Arakawa. How did Betsy die?
Well, hantavirus, and it's kind of surprising, but of course, hantavirus exists in those four states, New Mexico, Arizona, Colorado, and Utah. So, but it doesn't happen very often.
Okay, so I mean, I'm just fascinated by this topic. What is hantavirus? Because I was looking at hantavirus. I'm like, what kind of topic are we doing today, Doc? But go ahead. What is hantavirus?
Well, it is a virus which is carried by the deer mouse, and you can catch it by inhaling the dried deer mouse excrement, saliva, urine.
Okay, wow. Okay. And I would never have known about this, Doc. And were you because you're like an encyclopedia of knowledge, aren't you, Doc? From some of this stuff. Because did you ever diagnose someone with hantavirus?
Actually, I did have a couple patients with hantavirus. Around here, we do have it, but it's seldom. You get it in grain bins by cleaning out grain bins.
Okay, all right. So we're gonna find out. How do people get the hantavirus? You almost answered the question, but you answered it before me. Asking it. Go ahead.
Well, transmission is unique, Neil. You know, most of the times when people get sick, they get sick from other people. In this case, called a zoonotic transmission. In other words, it goes from mouse dust to people,
Oh,
dried rodent droppings.
wow. Okay. So it sounds disgusting to me. So, all right. Can people get hantavirus from other people?
No, not usually. As far as we know, there's been only one case of getting hantavirus from another person, and that was in South America.
Really? Oh my goodness. Okay. All right. So we'll definitely I'm not traveling there anytime soon, or I'm going to not eat their food. What are some of the early symptoms of hantavirus?
Well, it's like the flu, and I suppose there are people who get early symptoms and get well, but they are fever, dry cough, body aches, headaches, diarrhea, abdominal pain, nausea, and vomiting.
Oh my goodness. Okay. So things we don't want to have, Doc, do we?
Well, no, if you get those things and you happen to be exposed to mice, then you need to tell your doctor.
Okay. So this is mice. Oh, this is a shout out to my last landlord that didn't take care of stuff. Okay, so that we probably potentially let me go back to the symptoms, and this is a Media Giant Productions, Neil the Media Giant Haley newsflash: don't rent ever that house on Aileen Drive because we did have mice, and so let's look at some of the symptoms: fever, cough, dry, body aches, headaches, diarrhea, abdominal pain. So why aren't people diagnosed, especially because we had mice in our house? There's a mice infestation on my old house at 133 Aileen Drive. So just to let you know that 133 Aileen Drive. What are the early symptoms of hantavirus? Like, so you're telling me, is this happen where people, because the people from Fox Pest Control, which you shouldn't do business with, the people from Fox Pest Control basically said that there's droppings in the house. Can that cause you potential for hantavirus?
That is exactly how you get hantavirus, Neil, is from the droppings that aerosolize. As we go on today, I'll tell you how to not have mice in your house and
Okay, that's so.
do
But
not
maybe if
wipe
maybe
it out.
somebody doesn't treat it like Katrina, who doesn't treat it, understands that specifically. Let's continue with what are the late symptoms of hantavirus exposure?
Well, this is what Betsy Arakawa died of. So, and when you get
I
these,
had tons of shortness of breath and tight chest tightness.
yep, well, that's exactly the problem. It's shortness of breath, chest tightness, rapid heartbeat, fluid in the lungs, bleeding, and heart failure. And the mortality rate for this is 30 to 50%. So it's very, very high.
Wow. So that's if you continue to stay in there where there's mouse droppings
and you don't go in for treatment.
and you don't go for treatment. What happens? Without treatment, can you get better?
There are people who do get better, but if you really want to live, the treatment is supportive. You go to your doctor, you go to your hospital.
Okay, so this is just absolute BS. You didn't never thought a topic would go viral of the Royal Doc Allen where I'm being opinionated, but literally we had mice. Our landlord wouldn't take care of it. We have a great landlord now in Cleveland. Thank God we're out of Pittsburgh. Here, let me go really quickly, and I'm going to let's continue this conversation, Doc, with the next question. But what are your thoughts? I mean, so this is very interesting. So if we never get it treated, can you be better or not? If you just got it.
Yes, you can get better. About half, a little more than half of the people live if they don't get the pulmonary symptoms, if they don't get really sick.
Okay. Okay. What is the Hantavirus pulmonary syndrome? Tell me about that. So you
Well,
talked about, so we talked a little bit about, let's go to the complications first, Doc.
yes. Well, those include shock, low blood pressure, organ failure, and death.
Okay. Low blood pressure. Very interesting. Okay. What
Yeah.
about animals? Can they get the same types of symptoms?
I don't know. Of course, it's hard to ask the animals how they're feeling. They just die. But yes, these things, the hantavirus can be spread to animals, but the deer mouse is the main carrier.
Doc, can you get a test? Are you able to go ahead and get a test for the hantavirus?
Yes, you can, but you need to tell your doctor that you think you've been exposed to hantavirus, in other words, mouse or mouse droppings or rats. You have to tell the doctor because the hantavirus test is very special and it's not gonna be the first thing on their mind. This pathologist who found this in Betsy is known for being very thorough. And that's the only way they found it. And incidentally, the dog had twice as much hantavirus as Betsy had.
Oh my gosh. But so they were able to get that testing, and that's just, I mean, I literally could not breathe in that house. And I had to do inhalers all the time. So my question to you, Doc, is, and we knew exactly where it was. My daughter was going through it as well. This is like the newsflash, and Diane could even comment on this. So this is like a podcast, the World Doc Allen podcast we've never had, but it might be the perfect one as I'm already putting this all out there. Okay, let's go to the next question. But Doc, just terrible. Um, what is hantavirus pulmonary syndrome, HPS?
Well, that is again, that's what Betsy had, and that's what when they have trouble breathing and it goes to their lungs fill up with fluid and they have heart failure and organ failure and death.
When should you seek medical care?
Well, if you have those early symptoms and if you have exposure to mouse droppings, then you really need to get into your doctor and you need to tell them what you're worried about.
But those symptoms for 50% of people will, Doc, get better.
Yes, they will get better. Yes.
Is it based on immune system, things like that?
I think it matters the immunity. I think it matters your state of health. For example, if you're 30 years old and healthy, you're probably going to have a better chance of surviving hantavirus than if you're 70 years old and not healthy.
So this question is, Doc, does it go away without treatment?
There are there's no known treatment. So everybody who gets well, it goes away without treatment.
Oh, okay. But it's very dangerous because some people could be fatal, as we were finding out, especially what happened to Betsy Ann. Was not, but not who had hantavirus, not Gene Hackman didn't, just the wife did, right?
The wife did and the dog did. And
And the
that,
dog did, which is very concerning to me. Uh,
well, yes, you were going to say something,
and
Neil.
so I was going to say, what kind of symptoms does a dog have? Do we need to consult a veterinarian, or do I need to plug this into AI now?
Actually, they did take the dog. It's called a necroscopy when you do an autopsy on an animal. And yes, and they did find, like I said, twice as much hantavirus in the dog as they did in Betsy.
All right. So we talk about, so when do symptoms develop? How many, you said, when do symptoms develop, doc?
I would say that the symptoms develop somewhere between 1 and 3 weeks after exposure.
In what states do most infections occur?
Well, it's those box states, Utah, Colorado, Arizona, and New Mexico.
What about Pennsylvania if it's mice?
Well, actually, there is in the northeastern United States, there's a rat, a cotton rat, and there's a special kind, another rat, white-tailed mouse, in the southeast. So, yes, but the most common area, and especially the deer mouse, is the main vector in our country.
But we had tons of deer in Pennsylvania, right in our backyard. So deer contracted to the mice.
You know, it seems the deer actually is a special name for the mouse. They don't get it from deer.
Okay, so the mice give it to the deer.
The mice give it to people.
Okay, so just interested in the deer. Okay, do fatalities rates vary?
Yes, they do, depending on your age and depending on what the strain of the virus is.
Is there a cure for hantavirus? You said no. So even if it goes away, we still have it?
Well, no, what happens is when I say cure, for example, if you have bronchitis or if you have pneumonia, the cure is antibiotics. For hantavirus, there are no antibiotics in the first place because it's a virus. Some people say that Tamiflu, which is used for the flu, and another antiviral have been used, but there's no good evidence that says that those things are useful or helpful.
I mean, like I said, but you did see some in the Northeast. I will use AI to do more of a search because we were wondering about mouse droppings. What about a regular mouse droppings? That's not hantavirus.
Well, again, I think you're less likely to develop hantavirus if you don't have a deer mouse. But like I said, we don't have deer mice in North Dakota, and we do have hantavirus. As a matter of fact, I gave this talk a few days ago to seniors, and they told me about somebody who died of hantavirus after they cleaned their grain bin.
Am I? All right. So we talked about there's no cure. What is the treatment for hantavirus?
Well, in the beginning, say for example, your symptoms are only flu-like, body aches, fevers, chills, you probably do want to go to your doctor, and you probably do want to tell your doctor that you think you've been exposed to mice. Again, that's when they'll run the test. However, if you get sicker, then you're going to need what we call like an intensive care unit in the hospital. And sometimes you'll even need to be on a respirator.
All right. So that's scary.
Yeah.
Doc, let's just jump. Let's say it's not hantavirus, but it's mice droppings. What kind of sicknesses could you get just from straight mice droppings if it's not a deer mouse?
Well, it's hard to know, but you could, I would say, get flu-like symptoms, but probably not quite as sick from them because it's the deer mouse that really causes trouble. But I think that other mice can carry strains that aren't as aggressive.
Okay. I mean, but it can still be health wise terrible if there's mouse droppings in your house.
Yes, you don't want mouse droppings in your house.
Okay.
Good reason to
Wow.
have cats.
All right. So, is there any medication that helps for hantavirus?
Nope. Again, Tamiflu, they try. Ribavirin, they try. But again, the effectiveness is not established.
What is recommended cleanup?
Well, it's complicated. Wear an N95 mask, and if you've ever tried to wear one of those, you realize how complicated it is. They're hard to breathe with. You have to spray the droppings with disinfectant, alcohol, bleach, and water. And you want to do that because sweeping these things is exactly wrong. And so is vacuuming. You do not want to aerosolize. You do not want the rodent droppings to get into the air because breathing them is what makes you sick. So
We have someone a question from our live stream. Can it lead to bronchitis?
I would say that it could lead to bronchitis. Yes. We've learned over and over again when you see people dying from measles, they don't really die from measles, they die from complications like pneumonia. If you see, and we learned this lesson with COVID, people didn't die from COVID nearly as often as they died from the bacterial pneumonia that they got from the COVID. So yes, you can get bronchitis. You could even get pneumonia.
All right. So the basic situation, if you go get over it, can I get tested like months after being exposed to mice to see if I have hantavirus?
That's a good question, and I believe that you can because they would look for antibodies to hantavirus.
Very good. So it doesn't disappear 3 months later, 4 months later. It takes time to find these out of your system.
The antibodies are the things that would protect you from getting it again. So you want the antibodies to stay in your system.
All right.
How long the virus stays, I couldn't tell you, but I would guess it would be about 3 weeks.
All right. The best place to go is world.allen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks.